And thank you for giving us the opportunity to present the bone mineral content data. So this is in utero exposure to tenofovir containing PrEP prophylaxis in HIV-Unexposed. We're presenting on behalf of a whole collaborative group. Two of our co-authors have conflicts of interest, and they are acknowledged here. So TDF is a common drug of choice for PrEP, and it also has a combination in HIV treatment for pregnant women. In utero exposure to TDF was found to be associated with lower bone mineral content in HIV-exposed uninfected neonates. The data for infants born to women taking TDF PrEP are lacking. So we evaluated the bone mineral content in HIV-unexposed in the first infants in the first 18 months of life in association with maternal TDF. So infants were born and were randomized to immediate to deferred group, and it's part of the CAP 016 clinical trial that was conducted at our sites. BMC measurements for the whole body with head and lumbar spine were done by DEXA scanning at 6, 26, 50, and 74 weeks, respectively. Maternal tenofovir levels were measured at 2 time points in pregnancy. This is just a schemata of the follow-up. As you can see there, we had to exclude numbers of infants because mainly due to non-attendance, internal migration, and the COVID-19 epidemic, but we managed to recruit a number who had more than one DEXA scan done post. In comparing the two groups, the immediate and the deferred PrEP, we can see that their demographic, their characteristics were more or less the same, and there were no significant differences, including that for breastfeeding for more than 7 days, as well as the frequency of DEXA scans done in these two groups. For birth length as well, there was no significant difference. This is just a box plot to show the unadjusted BMC for whole body with head in the both groups, the immediate PrEP and the deferred PrEP, the infants born to these mums. And you can see there are no major differences across the trajectory of the follow-up. And that includes a bone mineral content for lumbar spine as well. We then looked at, we adjusted for birth weight, we adjusted for gestational age, very importantly, and we also adjusted for breastfeeding for more than 7 days. And then we compared the groups. And as you can see, when we look at the follow-up of the bone mineral content, there were no significant differences as well across the 6, 26, 50, and 74 weeks. We further looked at the tenofovir levels, and we divided the into two groups: the moderate adherence and low adherence. And based on the documented adherence patterns, Stranix and Chabanda, we used that. We found that in the low adherence group, those were less than 200, compared with the moderate to high. That's about 68% of our immediate PrEP arm, and then the PrEP unexposed, there were also no significant differences for both for lumbar spine and bone mineral content. Looking down at the 74-week, although the figures are different, they didn't come to significant difference. The numbers are smaller due to the fallout. So our conclusions, our findings indicate that no significant changes in bone mineral density were found in HIV-unexposed infants with and without in-utero TDF PrEP exposure, and correlating with most other studies. Our findings are reassuringly suggestive that in-utero TDF exposure does not alter bone integrity among breastfed infants in the first 18 months of infancy, even among women who demonstrate moderate to high adherence to oral PrEP regimen in pregnancy. Thank you.